Hi, this is Patty. Welcome to our latest Instagram where Amanda Lloyd, Dr. Lloyd, is going to be our guest speaker. The subject of today's Instagram is why you must change your skincare routine when you're pregnant or nursing. So, Dr. Lloyd is an expert at this because she's not just had one, but two babies. And she recently gave birth to her second child, a daughter named Madeline, who hopefully we'll see in this Instagram Live. And I thought that it'd be fun to have Dr. Lloyd actually come on and give us her perspective. She should be joining us in a few minutes. Oh, and she's messengering. But I think that this should be a very fun Instagram live. So I actually met Dr. Lloyd when she just graduated from her fellowship. So as most of you know, the path to becoming a derm is quite arduous. You have to go to medical school. You then have to compete to get the few spots for a derm residency. And then if you want to be in aesthetics, you need to actually do what's called a fellowship. And I met Dr. Lloyd when she was finishing up her fellowship. Sorry, hang on one second. Sorry about that. I have not seen Dr. Lloyd's... Oh, here she goes. View request. So I met Dr. Lloyd when she was finishing her fellowship. And it was very cute. She was like, I'm opening my own practice. I would love to carry your line. I don't think I'm going to sell a lot of it. And I said, it's okay, Dr. Lloyd. It's an honor having you in the Restore C. So Dr. Lloyd has been with the Restore C family, I think, for the last 4 years. So it's been great to have her be part of the family. Her husband is Dr. Pete, who's a rheumatologist. They have a beautiful boy, and now they have a beautiful girl. I'm not exactly sure why Dr. Lloyd can't connect. Oh, excuse me. So I'm going to just, I actually asked her to go live. Oh, here we go. Hi, Dr. Lloyd. How are you?
Yay! Hi, I'm good. How are you?
I am good.
See, I'm
So,
trying to get Maddie and Andy.
hi, Maddie. Oh my God. So your whole baby picture that you sent me was so cute, but it didn't show her
Oh,
face or her
I know.
outfit.
I know. The back of her outfit was so cute, but now we got her face. There she
And
is. Madeline.
how's Andy and Dr. Pete?
They're both very wonderful. They're frying a turkey right now. We're practicing for Thanksgiving.
Ooh, I hope
So,
they don't blow.
should be exciting.
Yeah. So I was actually telling the group before you joined about how we met and how you had just gotten out of your fellowship and we met at boot camp and it was
Yeah,
and how long we've known each other and how you and Dr. Pete and I had been friends even before Andy.
I know. I can't believe how long it's been. It's crazy. Time flies.
Yeah. So Dr. Lloyd, um, thank you so much for doing this.
Thank you for having me.
I thought that it would be really great. So I get at least 10 questions a day because you know me, I answer all the customer service. I receive at least 10 questions a day from people asking, Patty, is this product safe for pregnant and nursing women? And I thought that given that you not only have one, but two children, you can actually be the expert
Right.
to talk about this. So talk to me about why your skincare regimen changes when you're pregnant or nursing.
That's an excellent question, Patty. So, when you become pregnant, that's super exciting because a lot of times people try a long time and or people get pregnant right away, but it's a happy time, which is wonderful. But then your whole life kind of changes because you're now growing and human inside of you. And so you have to be really careful with what you do with your body. So, the topicals and things that you're using on your skin, if you put it on more than 10% of your body's surface area, it can be absorbed. Is a little bit less of a risk. Your face is about 4%, your neck is about 4%, and your chest is about 5 to 8%. And it depends on your definition of chest. If it's just your décolletage, then that's smaller than if you do, your whole chest down to the top of your cleavage. Um, if you're on any oral medications for acne or any other skin things, you need to make sure once you get pregnant, you need to make sure you're talking with your doctor to make sure that they're safe in pregnancy, because the baby and you share the same blood supply. And so with all those brand new baby cells developing, you want to keep them as safe as possible. And that includes as little of the kind of outside things that could possibly harm those baby cells, minimize those as much as possible. There's not a lot of data on them because you can't,
Right,
experiment on pregnant women.
right,
Um,
right.
but, less is more when you're pregnant. So you're super restricted when you're pregnant. Then when you're breastfeeding, your world kind of opens up, because then the things that go on your skin have to go into your bloodstream and through your body to end up into the milk, and then the baby drinks them, and then through the baby's GI and then into her blood. So it's got to go through a lot more pathways. So you can increase the number of things that you use on your skin, and you can be a little bit less paranoid once you're done being pregnant and are breastfeeding, or and if you're not breastfeeding then and doing only formula, then you can go back to doing whatever you want.
So what, so why can't you use Botox when you become pregnant? Hello?
A neuromodulator, there's 4 out there: Botox, Jeuveau, Xeomin, and Dysport. They all work by binding to a receptor which causes the muscle to relax or not contract. And so they haven't been able to do any studies on pregnant women getting Botox. And I know people are out there that have had, either they didn't know they were pregnant, or they're willing to take the risk and get Botox or any of the neuromodulators. But generally, because it is a foreign thing that's being injected into the body, it's going into the muscles, yes, but it could theoretically go into your bloodstream and then therefore into the baby through the umbilical cord. And you want, as few things to go to the baby as possible.
So I know, because you and I are friends, that you actually did not do Botox or filler during your pregnancy, but you did do a laser. So talk to me about
Yes.
the laser that you did, why you did the laser, and why it is safe for, while you were pregnant.
So everybody's threshold for safety is different. So for me personally, it's the longest time without Botox and filler, it's very hard, but I survived. But the lasers, there's nothing actually injected into the skin. With some lasers, people will put topicals on top to have it go down the channels and in. So I didn't do any of that. But with the lasers, I did 2. I did the XLV, which targets redness. And my chest was just getting so red, and I was like, I just need to treat it. And I don't think I even knew I was pregnant when I did or maybe I was like 10 weeks, like super early pregnancy. And so I did my chest. Now, that being said, in hindsight, pregnancy can cause redness of the face or the chest and spider angiomas and those things. And so I didn't get much with Andrew, my first pregnancy, but with Madeline, my second one, she really did a number on my chest. So that was maybe a waste, because I'm gonna have to do it again, because I got so many more after I was more farther along with her.
Why, why
But
did she,
it did help me feel a little. Sorry,
so
I didn't hear you.
what does that mean when you said she did a number of your chest? What exactly was going on and why?
So from the pregnancy hormones, it can cause the capillaries to break, and you can get these things called spider angiomas and hemangiomas, and so they're like little red dots everywhere
I,
and little broken blood vessels everywhere.
I have those and I've never been pregnant.
Well, you can get them from the sun and genetics also. So there's multiple reasons, which is why I was treating mine from the sun and from genetics. And then with this pregnancy, the hormones, I think maybe because she was a girl and Andy was a boy, we don't know exactly why. Something to do with the estrogen. It made the capillaries on my chest just become much more pronounced. And so I need to do another treatment again. The other treatment that I did, which I love, is the Clear and Brilliant, which I know you love them too.
Yeah.
Yes, so
Yeah. Yeah.
you can't
Oh,
you can't go wrong with a Clear and Brilliant.
yeah. So you can use that safely during pregnancy. That's like so awesome.
Yeah, so I did. I mean, everybody will have a different
Okay.
threshold, but I felt comfortable. It's just energy. It's one wavelength of light. It's going, maybe a few millimeters into the skin. The Clear and Brilliant's not a very deeply penetrating laser. I wouldn't probably do an active FX, a CO2 that's going to go super deep. But a Clear and Brilliant, just to kind of give yourself that, pick me up that we all need when,
Can
you're
you
pregnant or just need a pick me up.
explain to our audience what a clear and brilliant is? Because I know you know fan, but just explain to everybody what it is and why it's kind of so great and how it
So,
differs kind of the Fraxel and other kinds of lasers.
right. So a lot of lasers, so all lasers work by using one wavelength of light to enter the skin to create a change. And they target water to improve collagen or build collagen or clean out our pores, help with kind of tone and texture of the skin, tighten the skin. If they target heme or the redness in the blood cells, that's for the redness, so like the XLV that I did for my chest. Or they can target melanin, which is for the pigment, so for like brown spots and stuff. So the Clear and Brilliant is great because it targets water, and it's non-ablative, which means it doesn't vaporize or poke any real holes in your skin. It just heats these channels in your skin and kind of cleans out your pores. And the heating contracts the dermis, which is the second layer of your skin, which creates some tightening. And the heat also stimulates the fibroblasts in your skin to build more collagen, which helps to improve those fine lines and wrinkles that we don't want. And so you feel a sandpapery feel afterwards, and then you kind of have this healthy glow to your skin and smoothness, and your pores are cleaned out, and your skin just feels so much nicer because it's kind of removing that top layer of skin, but not in a harsh or difficult way. There's no downtime. You're pink for like 30 minutes after. That's one of the best things about the Clear and Brilliant is there's no downtime whatsoever.
And I have a question with you regarding technique. Dr. Lloyd, do you just do the recommended passes or do you run out
No,
your card?
I use the whole card. The recommended passes is like 4, I think, or something.
Yeah. Oops, sorry, we can't hear you. We lost.
The card is.
Sorry, lost you. Yep, keep
Can
going.
you hear me now?
Yep.
Can you hear me? Oh,
Yep.
okay. Sorry, I don't know what happened. The card is going to run out anyways because they put a time limit on it, which
Yeah.
is kind of silly. I mean, anyways. And so the face can handle, because the recommended amount is like 4%, 4 to 9% of the whole face. And so, if it's double, that's 18%, so that's still not a ton, but you get a much bigger result. Whereas a Fraxel is like 30 to 50%. So,
Yeah, no.
it's still significantly less than a Fraxel, so you're not going to increase the downtime, but you're going to increase the benefit because you are treating more areas of the skin. Now, in a darker skin type, you're like you're dark, but you're light still. So, in somebody maybe a little bit darker than you want to be a little bit more cautious so you don't get the post-inflammatory hyperpigmentation or the brown spots afterwards. Because if you do introduce too much heat at once, that can cause the cells that make the pigment to kind of get excited and drop out their pigment. But even at 20% of the skin, that's unlikely to happen because the Clear and Brilliant is so gentle.
So I'm going to just stop and just reiterate. So for everybody who is looking for a baby laser treatment, and I have nothing invested in the Clear and Brilliant, but I stand behind it. It's helped me reduce kind of my brown spots. But what was it? And the reason why I asked Dr. Lloyd about the technique is that I had no idea that you get a better result by running out the card.
Mhm.
And
Right, and people don't tell you, if they're using the whole card, like if you go to like Lasers R Us or, whatever laser place down the street, who knows what they're going to give you.
yeah.
So you make sure you see, a board certified dermatologist and somebody trained in cosmetics and knows, the ins and the outs of the lasers so that you can get the most benefit out of the laser that you're getting.
Well, you know me, Dr. Lloyd. My father was an intellectual snob, and he always valued the person who had the initials M and D after their
Right.
last. So, okay. So we talk about so basically Botox fillers not necessarily great during pregnancy because they could go through the bloodstream. Laser
Right.
okay because they don't enter into the body. So talk
Right.
to me about your skincare regimen and how that changed.
So my skincare regimen changed because there can be some systemic absorption. So basically, I stopped everything that I was doing once I found out that I was pregnant. Even when I was trying to get pregnant, I wasn't using my retinoid because retinoids are known teratogens. So that's like Retin A or Tazarac or Altrino or Adapalene, different, all of those different retinoids. Um,
What do they do? Sorry. I mean, what do they do? And
They interfere with the signaling of retinoic acid because they are retinoic acid, which helps in the development of the fetus. And so retinoic acid is in all kinds of places.
okay, so it could affect the development of the fetus. We don't know. Um, so that's why you stopped using it, and that's when you started
Yes,
the the 10x
you
serum.
got it. So that's when I started using
Ah,
the 10. I always use the rebalancing lotion, and I love the 3X, the all day, everyday lotion.
yeah,
And
yeah.
so that didn't change. And I also use the foaming face wash, so that also didn't change. Occasionally I'll use Glytone if I feel like I need a little glycolic peel, but usually I use the foaming cleanser. And so I took out my retinoid. I added in the 10X. I actually use the 10X in the morning and at night. So um, I took out the retinoid at night and I just still continued the 10X in the morning. Um, and then I also continued the eye cream.
And
Uh,
tell me why you felt comfortable using Restore C products because, as you know, I don't test on pregnant or nursing women for obvious.
right.
So why is it that your mentors in fellowship and all of that recommend Restore C and you not only recommend it, but you put your money where your mouth is and you used it not
Right.
just not just during Madeline's, but Andy's. And Andy's like a healthy and beautiful, like 2.5-year old. And, and so I'm like, oh, good. Like, didn't interfere. Yeah. But
Right.
tell me why you felt okay with that.
So, Restore C's active ingredient, as you know, is aquabutene XL, which comes from salmon roe. And these salmon babies are bathed in the enzyme and they come out normal. So, knowing that all these salmon, thousands and thousands and I don't know, maybe millions, how many salmon babies are
Yeah.
involved? Lots of salmon babies.
At a time. So you're absolutely right. I mean, it's a
You
crazy.
know. So since they all were okay, I felt comfortable using it. I did make sure to I don't put it, I just put it on my face and my neck. I wasn't putting any on my chest. And so
Uh,
even with that, on less than 8%, I was on about 8% of my body surface area, not
God,
10. And so that made me feel a little bit reassured, even though I'm not necessarily worried about the products.
I
But
love,
because you never know if something's going to get absorbed. I never put it on broken skin or anything, but um, I stayed under that 10% number.
yeah, you never know. It is, so what I always say to people who write to me is that I ask them to review the ingredients with their OBGYN.
Yeah.
Yeah, because it's kind of crazy because I've had a number of OBGYNs contact me, but as you know, my line is really sold to what is called the core. And so for our
Yeah.
or is really defined as dermatologists and surgeons. So
Mhm.
kind of a exclusive little set,
Yeah.
but it has worked out very well. So, okay, so transition from pregnancy to nursing, right? Because
Yeah.
Madeline dinner in 10 minutes. Um, what
If she's getting ready. She's
I
wiggling around.
how is how is
Hi.
pregnancy from nursing, and how did your regimen change, if it changed at all?
So when after the baby's born, like I said earlier, your world opens up a little bit more, and so um, started adding a few things back in. I still haven't put my retinoid back in yet
Ah,
because um, there's some data to suggest that you shouldn't have it touch the baby's skin because it could be absorbed because they can absorb things a little bit more readily through their skin. And so once she's sleeping through the night, then I'll start. She's not sleeping through the night yet, so I get up in the middle of the night and breastfeed, and my face of it, it's just a little bit too stressful to make sure my face doesn't touch her when I pick her up to feed her or whatever. And so I usually tell patients, you can start whenever you feel comfortable. It has to go through all these different pathways to get into them. Don't put it directly on the baby. Don't put it on your nipples. I don't know why you would, but don't do that. And personally, I wait until they're sleeping through the night because then I put it on at night after she's gone to bed. In the morning, I wake up, I wash my face, and then I go get her. And so then I don't have to worry about anything touching her, and I get the benefits of the retinoid.
I mean, you're like amazingly coherent. So, just for the benefit of our audience, Dr. Lloyd is emailing me basically at 4 a.m. her
Yeah.
time. And I'm like, okay. So it is kind of incredible. Like, Art, have you been sleeping during this whole thing? Because I
Well,
get,
I get up. I get up usually around 3:30 with her. 2 nights ago, she did a 1 o'clock. She has mostly dropped those. Originally, it was every 2 hours, so 11, 9 o'clock, 11, 1, 3, 5. We've dropped the one for the most part, but you kind of sleep when you can, and it's just like training. So, back to no sleep.
so when you actually, well, you're gonna be nursing for a while. So can you color your hair? You,
Yeah, I don't color my hair, but you can color your hair. It's just I wouldn't rub it all over the baby, but
okay.
you you go to the salon usually. Although people come to your house now, so that's all changed with with the world we're in at the moment. But you go to the salon, have your hair done, and then come out. Some will say you can pump and dump. So like say your feeding is due, you can pump that milk out and get rid of it if you're really worried. I'm not sure how long it takes for hair dye to kind of get out, but I imagine it's okay. But there's a great app called LactMed, which can look up any drug. I don't know if hair dye would be in there, but anything like Tylenol or ibuprofen or anything that you would want to take, any medication, you can look up in this app that's free for everybody to see if it's safe for breastfeeding. And there's lots of, lactation consultants out there, which some aren't so great, but some are really helpful and really knowledgeable. And I've used two with both, pregnancies. With Andy, I had one. She doesn't go to houses, so now I have another lady that comes to the house, and she helps kind of troubleshoot all of the fun quandaries of breastfeeding.
So Dr. Lloyd, Sharn04 has asked, is there retinol in Restore C products? So I'm going to throw that to you because you understand my
No.
product. I do.
Yes, no, no. So there's no retinol or retinoid. So a retinol is the over-the-counter variety of a retinoid. They're all in the category of retinoic acids. A retinol is 10 times less potent than a retinoid. So you can remember it by retinoid ends in a D. You do need a prescription to get that.
Oh,
Retinol, you don't. So that's in the over-the-counter product. So any product that says like for anti-aging or wrinkles or whatever, that will have a retinol in it. But that is not as strong, and you're not going to get as much benefit in your skin by using a prescription medication. Now, there's a small caveat. There's adapalene, which is a retinoid, and it's now the 0.1%, I think, or maybe it's the 0.03% is over the counter. However, it, in my opinion, is very irritating and doesn't as work as well as some of the other ones that do require a prescription. So that's, the one strange one that doesn't fit into the do need a prescription.
So we have about 5 more minutes left. I'm going to encourage everyone to take advantage of Dr. Lloyd and her expertise and ask any kinds of questions. She is probably one of the leading. So full disclosure, I'm in 135 offices. Everybody is what they call a KOL, which is a key opinion leader. Dr. Lloyd's mentors were actually the first to take Restoracy. So I focused on the KOLs because, as I always say about doctors, and I say this with love, doctors are kind of mean, sort of snobby, and very competitive. And they're like, we are. And
especially in the aesthetic realm, I'd say. Dermatology, ophthalmology, facial plastics. Yeah.
And so when you're with the best, they attract the best. And Dr. Lloyd, I am very proud to say, when I met her 4 years ago, was one of my up and coming doctors, and now she's really blossomed. And I'm very proud. And
thank you, Patty.
I'm patting myself on the back because I'm so good at spotting good talent. But yeah, so it's kind of interesting because this has been a very quiet crowd.
Mm-hmm.
I'm a little surprised because everybody is so concerned, right, about this whole topic. So what I want to do in the last couple of minutes we have, Dr. Lloyd, is for you to actually kind of give the audience, and this will be recorded as well, so people can go back and watch it, sort of, or like pearls. I mean, they're called pearls. What your pearls are, what you need to do to still look good, have your skin still look good and healthy while you're pregnant and you're nursing.
Yeah. So the most important thing while you're pregnant and nursing is to get sunscreen on. The sun does so much bad and harm to our skin. You really got to get sunscreen on. When you're pregnant, you want to make sure it's a physical sunscreen. The chemical sunscreens, just in case something did get absorbed, they're a little bit less known, I suppose, than the physical ones. So, zinc and titanium, zinc oxide and titanium dioxide are great sunscreens. Make sure you pick a sunscreen that has that in it. So that's definitely the most important thing. And then, probably secondly, don't freak out over every little bump that you're going to get, because you're going to get lots of weird bumps and red bumps and brown spots and all kinds of fun things from being pregnant. And a lot of times they go away. And if they don't, there's a laser. So don't worry.
And so,
you can always treat it after.
So Tear 858, sorry, said, what is your can't live without Restoracy product?
Ooh, that's a tough one because I like so many. Well, now I'd say, since I'm not sleeping, the eye serum, because it has some caffeine in it, and that helps to get rid of the puffiness and dark circles under my eyes. So at the moment, that's my can't live without. I do love the Lip Magic also, because that helps to just make my lips so supple and beautiful. And then the rebalancing lotion I really love, although it might be getting replaced by the all day, every day.
Yeah, the all really good.
That's pretty good, yeah.
And you can layer it with the 10X top. So sincerely,
Exactly.
Anything for hyperpigmentation during pregnancy?
A laser. Yeah, because you can't use any of the other, or it's not recommended to use hydroquinone or any of the other bleaching agents. The botanicals like vitamin C and iron and a couple other botanicals, they're just not studied. And so, it's your baby that we're talking about. You don't want to risk it.
And then Jody Sage said, great information. We have switched all of our pregnant and our breastfeeding clients with 100% success, and everyone has stayed on it because they have such great results. Yay!
Yay! Love that.
Yeah. So I don't want to keep Madeline from her dinner. And I want to all conclude by really thanking you really for your time. Please give my regards to Dr. Pete. And I hope to see you when we can travel.
I know.
I know.
Me
I want
too.
to your new house. I kind of,
No, you get a little bit of the view. You can see Jupiter behind my head. This is Jupiter.
I know. I actually thought it was like a fake wall, and I realized it is from your house. So
Yeah,
I'm
I'm standing on my balcony.
yeah, I'm inviting myself and Dr. make his famous
Yeah,
pipe. Yeah.
please come visit.
Thanks for everything.
Thank you.
Bye.
Bye.